Alrighty. Hi everyone, my name is Kristen Huff, and this week I'm going to present to you on so we're going to be talking about data sets and information management. The objectives of this is to better understand data sets and information management, and also to understand how data can be used to inform nursing practice and to enhance patient care. So as we all know, everything that we do day in and day out is all based on enhancing patient care and patient safety. So this is just going to be a quick 10 to 15 minute talk about how we can use data to really improve what we do every day, and what we should be looking for and where we can find this data. So data sets. Data sets are a collection of data. Now this can be, a wide range of things, but really essentially it is just a collection of data that's related information, composed of separate items. They can all be manipulated, but it's all just data. Generally, a single table would be a data set. In healthcare, data sets include a vast amount of medical data, so various measurements could be financial, statistic, demographics, populations, insurance, wide range of data that we can look at, but standardization is really key for this. So if we're not measuring things the same way, or we're not standard in the way that we're approaching something, one data set may appear to be different, or appear to be similar, but actually be different because it's measured differently. So standardization of data sets is important, or at least being able to recognize that they aren't standardized, if that is the case, is very important, because you may be looking at data incorrectly. Like if we were measuring length of stay in hours, but another place was measuring length of stay in midnights, then, my length of stay may look like 36 and your length of stay may look like 3 or 2. So I think it's just important to be able to recognize that. Some examples of health or data sets, healthcare data sets, are the UHDDS, which is the Uniform Hospital Discharge Data Set. It's an initiative of the Department of Health, Education and Welfare. It was first implemented in 1974 and has since undergone several revisions. This defines a set of common uniform data for every hospital to go by. So this standardizes the uniform discharge data set. The next data set we have listed is the Uniform Ambulatory Care data set. Again, uniform data set for ambulatory care. Minimum data set for long-term care, also published by the Department of Health. Standardized primary screening and assessments. So again, standardized. DEEDS is the data elements for emergency departments. Essentially, a lot of data sets just basically working to standardize data to make sure that all places are using standard information, standard measurements, so that we can all be on the same page, so that when people are looking at data, we're not looking at them differently. So the last couple I have listed there: OASIS, the Outcomes and Assessment Information Set. This is used for home health, and then health plan employer data information set is the last one. So the data interchange. This is essentially the rules and regulations. So any exchange of data is highly regulated, federally, nationally, locally. This is basically HIPAA. Any exchange of data has to be highly regulated to make sure that healthcare information or personal information is not being improperly used or shared or viewed. Essentially, to improve healthcare safety, efficiency, but also to increase the amount of health IT, but decrease the amount of improper sharing, exchange, etc. So data mining. Data mining is important because it's important to find the data, know where to find the data, and like where you would go for what data, but also to be able to pull out what you really need. So there are many, many places to find data, especially healthcare data. It's out there. There's a lot of it. These are just a few examples here of some of the sites that can be used. I used the AHRQ as an example. The AHRQ is the Agency for Healthcare Research and Quality. This is an excellent site. There are tons of infographics on this site. There is numerous data sets, information. You can find data on things like the number of, what was one I saw yesterday? The number of opioid overdoses, female, male. There was an infographic. There is you can find information on national goals like CAUTI and HCAHPS, pressure ulcers, anything valid. So this is actually a site that I've used in work. We looked at catheter-associated UTIs in the ICU, as well as healthcare-acquired pressured ulcers, and we needed to find national data to find how we should change our goal. So we were looking to decrease the rate, but we needed to find a national average to set our goal at for Lake Hospital. So this is actually the site that we use to do that in my current work. Information management. So this is any way to manage information. So all the technology used in the care of the patient, the care of the nurse, the provider, anyone who's providing care, any of the equipment. So EMR, which is Epic for our system, cell phone, telemetry monitor, bedside vital sign monitors, EKG machines, bladder scanners, workstations. This is endless. So any way to manage information, so all this information is coming in, and these forms of technology are managing them. Like a telemetry monitor, we have all these electrical stimulus coming in from their leads. The telemetry monitor is managing this, making it in a way we can read it, standardizing this information so that we can use it in our daily work. So improving care and relating this to practice. So I think this picture on the left really explains it well for me. So this is everyone teaming together with technology and with data to do everything we can to improve patient care. So collecting the data, looking through these data sets, standardizing this, coming together just to really work. Everything we do is to provide the best patient care, and so we really need to be using the data to ensure that our current practices are what's proven. If there's something better, let's find it. You know, this is really what we need to just be focusing on to take our practice to the next level. I think there's a lot of things that we do every day that maybe we don't recognize. We do things that are little projects that are evidence-based, and we're looking at data, but maybe not recognizing all the steps that we're taking. And so this really is great. Data sets and information management is so important to everything we do, and really helps us provide the best patient care for all of our patients. Thank you for everything.